So we'll continue discussing about drugs that are used for vomiting. So now we're going to talk about the drug called promethazine, which is an antihistamine. So promethazine and cyclizine are two of the known antihistamines. So these drugs, of course, they are not only used for treating vomiting, but they are also used for treating many other conditions. But for this series of lectures, we're just going to talk about the role of these drugs in treating nausea and vomiting. So what are the mechanism of action? So what is the mechanism of action of these drugs? So these drugs are antagonists at the histamine 1 receptor. So we have the histamine 1 receptor. So these drugs are antagonists. They are competitive antagonists. Okay. Competitive antagonist at the H1 receptor. So indications for giving this drug, promethazine, okay. Number one is mainly you can say motion sickness. So it's given for motion sickness. So people who have problems when they take buses, etc., okay, or cars, and they get nausea and vomiting, so they can take this drug. Number two is drug-induced vomiting. So there are many drugs that can cause nausea and vomiting. So many. For example, if we take an opioid like morphine, okay, which is given in acute coronary syndrome, myocardial infarction. So when we give morphine, some patients develop vomiting, so you can give promethazine to treat that condition. Number three is vestibular disorders. Okay, so it's related to the ear, problems with that. So these include having vertigo, okay, the sense of things going, turning around you, going around and around you, and also tinnitus. Okay, so these are three main indications for giving promethazine. And we'll talk a little bit about the preparations and dosage for promethazine. So the main brand name for promethazine is Phenergan. So it's found in at least two forms, tablets, and also can be found in the injection form. Okay. So this is a drug that can be given intramuscularly and intravenously. So this is a very nice feature of this drug. So you can give about 25 to 50 milligrams of the drug stat, okay, immediately. Stat means immediately. So this is Phenergan is the brand name, okay, brand name, okay, brand name for promethazine. So what are the adverse effects of giving promethazine? We have drowsiness, people become drowsy, And then we have the anti-muscarinic effects. Okay, anti-muscarinic effects. So when we talk about anti-muscarinic effects, what we see is usually sympathetic effects. Okay, sympathomimetic effects. So for example, you have your mouth, your vision becomes blurry. Okay, blurry vision. And then we talk about your mouth. Okay, so it becomes dry. And then when we talk about your urination, so that's your bladder. Okay, just imagine trust me, that's a bladder. Okay, so you have urinary retention. It's not going out, so it's staying there because of the constriction here. So you have urine accumulating here, so urinary retention. And then you have effects like palpitation. Okay, so which is a sympathomimetic effect, and also arrhythmias. Okay, your heart rhythm becomes abnormal. Okay, and fifthly is a skin effect, which is having rashes. So these are the adverse effects of, or the side effects of giving an antihistamine such as promethazine. Okay, you become sleepy. Okay, you have anti-muscarinic effects, so a bit blurry vision. So when you have blurry vision, you have drowsiness. Of course, you don't want patients to do certain things. For example, they shouldn't drive. They shouldn't operate heavy machinery. They are not supposed to sign important documents. So etc. 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 So they have blurry vision, dry mouth. So dry mouth is not that bad. Okay, and then urinary retention. Okay, they cannot pee. They cannot pass urine. Palpitation. Okay, that can be a bit disturbing, and arrhythmias. It's also bothering them. Besides having the rashes. So what are the cautions or contraindications for giving promethazine? Number one is having prostatic hypertrophy. So when your prostate becomes enlarged, okay, so it's going to impinge on the urethra. So when it impinges when it impinges on the urethra, so again you get urinary retention, so you cannot pee. So which is already one of the adverse effects of taking promethazine. So you don't want to worsen the condition of urinary retention by giving an antihistamine in patients with prostatic hypertrophy. So prostatic hypertrophy can be many things, including one of the common ones is called benign prostatic hypertrophy. Okay, so which is common in the elderly. So the older a man gets, the higher chances that he will get benign prostatic hypertrophy, and if he lives long enough, he might develop cancer. Okay, prostatic carcinoma. So it's not related to this, but of course it manifests in the same ways. When it comes to the urethra, of course, it's going to cause urinary retention. Also, you have to be cautious, of course, in urinary retention, which is obvious. And then glaucoma, so we can still, I hope you still can remember that it causes blurry vision. So glaucoma, you don't want to give patients with glaucoma, which is a condition where you have increased intraocular pressure, okay, in the eye. And then you have, you don't want to give this drug in pyloroduodenal obstruction. And this is again due to the anti-masculine effects. So if you have anti-masculine effects, you will have reduced in GI motility. Okay, reduced in GI motility. Your gastrointestinal system, the motility, the movement is reduced. Okay, reduced peristalsis, all that. So if, of course, if you have pyloroduodenal obstruction, okay, obstruction, and you have reduced motility, so you don't want, it's just going to worsen the condition, okay? So it's just going to worsen the condition, and then you cannot have, and your food will not be moving, okay, through the system. So the pylorus part of the stomach, and then there is a duodenum. So that's all in brief with regards to promethazine. Promethazine, okay? Promethazine, which is an antihistamine that can be used for many reasons, but our focus now is just on the gastrointestinal system. So that's why we're just talking about the effects of promethazine in treating nausea and vomiting. Okay, see you people in the next video. Thank you for watching.